In a previous video, we talked about how orthobiologics work by sending signals that calm inflammation and reset the joint environment. But signaling is useful only if it reaches the right target. And most people, including many clinicians, look in the wrong place. Cartilage has no nerves. It cannot produce pain. The real pain generator in knee arthritis is the bone beneath the cartilage, the subchondral bone. Subchondral bone edema is not water in the bone. It is a biological storm inside the bone marrow. It includes microcracks, fluid congestion, rising internal pressure, inflammatory swelling, and overactivation of osteoclasts, the cells that resorb bone. On MRI, it appears as a bright white patch. In real life, it creates a deep drilling type ache, especially at night or after activity. The subchondral bone is a true shock absorber of the knee. Every step, every twist sends force directly into this layer. Over time, especially when inflammation is high or alarmins are active or metabolic stress is uncontrolled, the bone begins to develop microcracks. These microcracks trigger a large internal response. Intraosseous pressure rises, venous outflow slows, the marrow becomes inflamed, and cells release alarmins, danger signals. Alarmins activate osteoclasts, leading to bone resorption, osteolysis, just below the cartilage. That is why the pain feels deep, severe, and persistent. The bone itself is inflamed, and this is why surface level treatments fail. Painkillers cannot reach the bone. Steroids suppress symptoms briefly but do not heal microcracks. Supplements cannot reduce bone pressure. Physiotherapy cannot switch off alarmins inside the marrow. This is why so many patients suffer despite x-rays that don't look too bad. The problem is deep inside the bone.
Before we go further, the next few slides contain detailed medical illustrations. You can simply listen to my explanation, but if you'd like to read the text, please pause the video and zoom in for clarity. Activation phase. Mesenchymal signaling cells detect microcracks and inflammation inside the subchondral bone. Delivery phase. These cells release exosomes, tiny packets carrying microRNAs and anti-inflammatory mediators. Building phase. These signals activate osteoblasts and stimulate new bone formation in the subchondral layer. Protection phase. At the same time, MSC signaling suppresses osteoclasts by blocking RANKL, RANKL, reducing bony resorption. Restoration phase. As microcracks heal and pressure inside the bone decreases, inflammation settles and deep knee pain begins to fade.
Orthobiologics help only when they reach the correct anatomical target. The target is not the joint surface. The target is the subchondral bone. Mesenchymal signaling cells release anti-inflammatory cytokines, exosomes, microRNAs, osteoblast supporting signals, and molecules that block osteoclasts. These signals reduce microcrack inflammation, lower intraosseous pressure, calm alarmins, slow down bone resorption, and restore bone homeostasis. When the subchondral bone heals, the knee becomes quieter, stronger, restoring structure. Why does subchondral edema cause night pain? Because when you lie down, venous pressure changes, bone pressure equalizes, chemical mediators accumulate, and alarmins irritate nerves.
Subchondral edema causing night pain due to bone pressure equalize venous pressure. Chemical mediators accumulate and alarmins irritate the knee.
This creates the classic deep night ache that so many arthritis patients describe. Compression. So, orthobiologics must be delivered precisely, not blindly into the joint space, but toward the bone that is truly on fire. But signaling alone is not enough. We must also control metabolic inflammation, immune activation, mechanical load, and joint fluid chemistry. That is exactly why isolated injections fail. In the next video, I will show you how all these elements come together in the Prasad Protocol, a structured, targeted, high-signal approach designed to extinguish the fire inside the subchondral bone. I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Centre. If you have deep knee pain, night pain, or pain that has not responded to conventional treatment, the problem may be inside the bone. Visit my website or message me on RTI to learn more about biological solutions for knee arthritis. I will see you in the next video.